It's one of the things I'm most proud of here is how well our teams work together. It's an incredibly collegial environment, and everyone's centered on our patients' success. The reality is, there are a lot of things that we're doing here that aren't easy, and they take a lot of hard work, and they take a lot of focus and organization. We want to ask, well, why can't we do this, and why can't this be successful? You know, I was trained that if someone's BMI was over 45, then they had to lose weight to get a liver transplant. And the next question has to be, well, how can I get this person with this problem to the operating room to give them a life-saving organ? So we asked the question, can we transplant these people to give them the power to change their lives and lose weight? And I think we're answering it. I think we're doing a really excellent job with our high BMI patients. One of the things that we've done for our alcoholic hepatitis patients, those patients are different than patients who have long-term cirrhosis from drinking. And so what we did was we established a program specifically for those patients. And it's a stringent program. I mean, it's tough. You have to sign a contract prior to your transplant that says you'll never drink again. You have to agree to inpatient treatment. You have to have really good family support, but we'll help you figure out a way to get you there if we can. And I think that's a little different. Don't give up, because maybe we weren't your first choice, but we'd be happy to be your second choice. And we want to work to give you another chance. So if you've been turned down for liver transplant for really any reason, I feel obligated to look at your case, because I can't tell you without knowing what's going on if we can make this happen and we could save your life. But I can say that we'll do everything possible to do that. It's pretty staggering. It's up to 4 times more people who need livers than we have donors. And living donor is kind of this really fantastic way to bridge that gap. The donor at this institution is going to be taken care of by a surgeon who's performed over 700 of these operations, may well be the most experienced living donor liver transplant surgeon in the country. And you're going to get a team that has been doing living donor liver transplant for each surgeon for their entire career. I have patients who work full time. I have patients who run marathons and send me a card every year when they run a marathon. I have patients who are in all walks of life, or in doing all sorts of jobs, or enjoying life the way someone who didn't have a transplant is. And you shouldn't think of yourself after this as a liver transplant patient. You're just like a person who had a liver transplant. I mean, this isn't an experimental therapy. This is established medical therapy to kind of restore your life.